Hello, my name's Ryan. I'm one of the psychiatric NPs with this practice. Hello, my name's Ryan. I'm one of the psychiatric NPs with this practice, and I'd like to thank you for your interest in our practice, as well as go through what are the common questions patients may have and how we can help. And in addition to that, I'm going to go over how to schedule an appointment very easily. Typically, we have availability within about 5 days. We see a variety of common conditions as well as less common conditions. Some of the more frequent things we'll see patients for include ADHD, depression, anxiety, bipolar, PTSD, panic disorder, insomnia, OCD, and a variety of other mental health conditions as well. We do prescribe medications for conditions such as ADHD, depression, anxiety, bipolar, other mental health conditions too, when indicated. But our services are really set up so you can get high quality services that are easily accessible, affordable, because we don't believe people should have to wait very long for the services. And we also believe that patients should have high quality services no matter what. So they shouldn't have to settle. And that's one of the things we're focused on is how can we provide a more integrative, collaborative approach that works for as many people as possible. And so that's where we really set ourselves aside because we provide longer appointment length than typical industry standard. We provide, as I said, a more collaborative approach, and we use integrative approaches such as nutrition, supplement, meditation, exercise, and other latest approaches that we find from conferences. So we're very big on incorporating a whole variety of different approaches that are going to work. We also provide supportive therapy as well. And as I said, we do prescribe medications as well when appropriate. So when you schedule, you're just going to hit the schedule now button. And when you do that, it's going to take you to this form here where you're going to fill out the information here. So you're just going to put in your demographic information. If you're using insurance, you're just going to put yes. And then you can see the list of the common insurances that we take here. So if you look at the bottom here, you can see where you put in your insurance company name, group number, ID. And when you submit that, what's going to happen is our billing department is going to check eligibility for you by calling your insurance and checking that. So what happens is, let's say, for example, you weren't in network or didn't have benefits or inactive, then we'll let you know that before the appointment. So we just ask that when you do get the notice, that you just respond back and let us know within reasonable time frame if you don't want the appointment. But we make this really easy for you by getting your insurance information for you, because we understand it can be confusing for many people as far as their insurance, and it's not always clear to us, but we do everything we can to get the right information from your insurance. And the way we do that is we call them directly, and then we also have other databases too we use. So we literally have like 3 checks that we do with your insurance and to make sure everything checks out. So it's pretty much the most thorough process you can get, when it comes to seeking care. I don't know of anything more thorough than the way we do it here. So if you're interested in services, just put down your insurance. And if you're not interested too, feel free to not put down your insurance if you don't want to use insurance. But most people do still want to put it down because, now and then, you may have an insurance name that you're not sure about, and then we can check your eligibility. But in this case, I'm just going to put no. You still can be seen if you're not using insurance. You would just do the cash pay rate, which I'll go through here in a moment. So now I'm going to hit the submit button, and we're going to submit this. And now it's going to redirect you to the appointment scheduler where you can make an appointment, and you'll have a calendar where you can pick your date and time. So I'm just going to select one myself here. Now, let's say I didn't have the opening that you wanted here. So what you could do then is just hit the back button, and you can schedule with one of our other providers here. And then once you go to schedule an appointment here, you're going to just put in your information here. You're going to put in your name, and then you're just going to put yes for appointment reminders so that you get appointment reminders, and then hit continue. And then now you're down to the payment screen. So we do have where you put your payment on file. And what happens then is before your appointment, according to your eligibility, then you'll just be charged according to your benefits. So in that case, too, you'll get an invoice sent to your email each time. And then down here, you'll just have the terms and conditions that you can then review here as well. So everything's just pretty much there, transparent. Cash pay at this time would be $289 for initial and $159 for follow-up appointment. We do ask for 48 hours, notice when possible, letting us know if you're not going to attend your appointment. And then once you book, you're just going to have this here that says open up intake form. So when you open this up, this is just your intake form to fill out. We do want you to fill that out within 2 days, just so the provider can look it over. And we want to know, why you're seeking care, how we can help, previous medications you've been on. So we really want to be as thorough as possible. And so that's why we send that to you. We do recommend that you use a desktop computer to complete it. You can do it on your phone, though. Many of our patients use the phone and have no problem doing it. But it does save a little bit of time, you find, just doing it on a computer if there's some typing involved. But you'll get an email with your intake form as well. So if you forget to do it at the time, just hit the open form here, and then you can do your intake form. But you can also do it right here. We do recommend doing it right away after you make your appointment, just so it's all done, you have it locked in. But we do, again, ask that you do it within 48 hours to reserve your time. Otherwise, we have to give it to somebody else, just because we have to know why you're here, like how we can help, previous medications you've been on, that we can provide the best possible care. So if you do have any questions, feel free to reach out to us. Otherwise, I look forward to seeing you soon. Take care.